Hello, this is the office of Dr. Grunberg calling to remind of an appointment on Thursday, August 4th at 1:30 p.m.
At first, I thought I had food poisoning. I went to my primary care physician and said, hey, just so you know, I think I got something. This is what the symptoms are.
I actually think there's some, transphobia on the doctor's part, so that they don't put their hands on their patients probably enough. It might make the patient a little uncomfortable, the doctor's a little uncomfortable, and that's just the perfect storm for skipping a 30-second exam that can save someone's life.
He was petting, like interacting with my stomach the way I interact with my dog's stomach. Like, oh, what a good boy, but not like getting in there and like feeling stuff. I don't, it was like, hey, yeah.
You want to see this?
Oh, now it's all.
I mean, people love it.
The new coding came about, ICD-10, this past year, and that has now assigned gender to the diagnosis. I struggled with, what is your code? Is it a male breast cancer? Is it a female breast cancer? And so I had to talk to my office manager to say, I can't even generate this note because it requires I click on one of these and the location. So what do we do?
Most people don't want to think about this kind of stuff, but when an individual in your family or in your sphere of friends has this, all of a sudden it becomes something very interesting and very important.
It wasn't that long, but it made a pretty big impact because you see like Iwan, perfect student, coming in with this notebook of like, all these questions organized and sitting in front of the doctor, and you really just, watching the whole interaction between Iwan and the doctor. You have your notebook and you realize like you really are in charge of yourself, and if you don't really ask all these questions and make a point to write it down, there's no one else that really can know that or look after you except for yourself.
Here was a healthcare professional who was telling me, you're not ignoring it. You do in fact have something about the size of a papaya in your gut, and I will call your doctor at Kaiser and make an appointment.
Please arrive 10 minutes early and bring your insurance card and any new medications.